I think in the interest of time, we can begin. Welcome, everyone. Thank you so much for joining us today for the launch of the third edition of the Tobacconomics Cigarette Tax Scorecard. I'd like to thank everyone for listening, and I would like to thank our author team up here on the virtual dais here. And I would also like to thank our esteemed colleague, Rosa Sandoval from the Pan American Health Organization, who has very graciously agreed to be our discussant today. My name is Jeff Drope. I'm a research professor here at Johns Hopkins University and the director of the Tobacconomics program. I imagine I am largely preaching to the choir here, but I think it's still a really great idea always to step back and remind ourselves why we're here. And that is because tobacco use is the largest preventable risk factor for most major non-communicable diseases, and even a few communicable ones as well. On average, it takes about 11 years off of your life. It causes millions of DALYs, which is a really fancy way of saying it causes a great deal of sickness and disability, and it really prevents people from living their best life in terms of their health and well-being. It costs more than 8 million lives a year and about $2 trillion in economic costs, roughly 2% of global GDP. So an extraordinary amount of damage to our collective society. But we know there's one intervention that works, and it works especially well, and that is raising taxes, specifically raising excise taxes. Higher taxes lead to higher prices, and consumers react to higher prices. Especially young people react by not starting to use tobacco products, to smoke and other tobacco products. And then people who are already using tobacco products will quit or cut down. All of these things are good for public health. Next slide, please. With all of this in mind, about 4 years ago, we set out to evaluate how well governments are doing on taxing tobacco products, and specifically cigarettes. Previously, we had mainly used the tax share of price as our measure of performance. It's a very useful measure, but we recognized in our own work that we were actually using several other indicators. Led by Frank Chalupka, we developed the first edition of this scorecard, adding to tax share 3 additional components: price, change in affordability, and tax structure. And my colleagues will expand on each of these in a moment's time. Next slide. We took advantage of the excellent data from our colleagues at the World Health Organization, who collect price and tax data every 2 years. And I want to just give a shout out to them. This is an extraordinary data collection where they actually approach each country and get these data direct from ministries of finance. It's a really huge effort, and we are grateful because we get to use these excellent data. We combine it with other excellent macroeconomic data from the World Bank and other sources. We're also grateful for those data. And we base the logic of our scorecard rubrics on the rock-solid academic literature on this topic that exists. This includes the WHO's Tobacco Tax Administration manuals. There are 2 of those, and we use them both. 2 seminal works by the World Bank, as well as a vast, vast peer-reviewed literature that exists on this topic. We have subjected this to peer review when we developed the scorecard originally, and then subsequently, when we generate new results, we subject it to more peer review. Next slide, please. Let me start with an overview of the overall scores. Next slide. This is a pretty simple map to read. The darker the color, the better the score. And I think you can probably read this on your own and see that we have an awful lot of light blue here. And light blue is not what we want to see. We want to see a lot of dark blue. And so what we're looking for over time is to see that this map to simply get darker each time we do the scorecard. As we'll see in a moment, that is not what we have been seeing, unfortunately. Next slide, please. When we look at the overall cigarette tax scores for 2022, what we see is the global score is 1.99 out of 5. Unfortunately, this is actually a decline from 2020 when it was 2.25. So what we've actually seen over time when we started tracking this, so back in 2014, the score was 1.89. We saw a modest improvement over the years up until 2020, and then we've unfortunately taken a step backward. We're not quite back at where we started, but we certainly aren't where we want to be. So what does this look like? Well, if you look across the green there, we see that all regions have, there's quite a variety of scores. And I can tell you that all of those regional scores, average scores, are down from the last scorecard. So the decline that we have been seeing, unfortunately, is very much across the board. When we look to the right, to the brown and yellow bars, this is the World Bank country income groups. And what we see as well is a large variety, with the highest scoring being the higher income countries, and then the lower income countries being quite a bit lower. What we know is that only the low-income country group actually went up between 2020 and 2022, and all of the other three groups went down. So we can see that this really is a fundamental problem. I can speak more broadly. We can see that 31 countries improved between 2020 and 2022. This is way down from the previous edition of the scorecard when 67 countries improved. Unfortunately, we actually saw 76 countries experience a decline in their overall score compared to 37 in the last scorecard. And only 40% of countries in the scorecard of the 170 countries scored at least 2.5 out of 5. So not even half are scoring half. And this is very problematic, and we are a little bit worried about this. Next slide, please. Here we see the only two countries, France and Mauritius, are highest performing countries who scored above 4. This is actually down as well from 2020 when 5 countries scored 4. And you can see they do very well on price on that tall blue bar. And they do better really across the board than the high income country average and the global average, but you can see they're especially doing better on change in affordability. And we'll talk about that more in a moment. And we can see that the change in affordability scores were very, very low on average for the globe and even for high income countries. I'm going to stop there, and I am going to hand it over to my colleague, Min, who is going to go over the first two components of the scorecard. Over to you, Min.
Thank you, Jeff. Hello, everyone. Thank you for having me here. I am Min Thu Oo, a research analyst at the Johns Hopkins University. I would like to briefly present two components of the Cigarette Tax Scorecard. So let's start with the price component. Next slide, please. First of all, it is important to understand why cigarette prices are important in affecting the smoking behavior. When the price of the product gets higher, its consumption generally reduces. This is the case with the cigarette prices. However, cigarettes are relatively price inelastic, meaning that it requires large increase in price in order to observe the reduction in the consumption. One important point here is that because of the inelasticity, although cigarette consumption goes down, tax revenue generally go up. And then price has a significant influence on the tax systems. Regardless of how tax structure and tax share of the price are ideal, if price remain low, the tax system will not be optimally effective. Next slide, please. Let's see how cigarette price affect the consumer. Increase in cigarette prices encourage quitting or not starting, which results in reduced smoking participation. That explains nearly half of the price-related declines in consumption of the cigarette. Those who still smoke consume less cigarettes than they did before. Studies have been highlighted that young people and the people from the lower socioeconomic groups are more responsive to the price changes. Because of that, they benefit more from reduced cigarette consumption due to price increases, improving their health and economic equity. Next slide, please. So this is the rubric for the cigarette price scoring. We have 6 points from 0 to 5, and 5 is the highest score. Here we use the international dollar purchasing power parity to compare across the country. The purchasing power parity, PPP, tell us how much money we need in each different countries to buy the same goods and services using a common reference point, the international dollar. Countries with cigarette price of more than or equal to 10 international dollar to purchase 20 cigarette pack of the most sold brand gets the highest score of 5. Then the score reduced by 1 unit for prices with every $2 drop. When the price is less than $2, the country will get the score of 0. Next slide, please. This figure shows the overview of the cigarette price score in 2022. So the darker the color, the higher the score. We have data reported for 170 countries. Only 20 of these get the highest scores of 5, which is down from 28 countries in 2020. On the other side, 14 countries received the score of 0 in this component. Next slide, please. This figure represents changes in countries' price scores between 2014 and 2022. Cigarette price scores have mostly risen over time, but the overall score slightly dropped in 2022. When compared to 2014, 7 countries saw more than 2-point increase, and 18 countries experienced 0 to 1-point decline. Next slide, please. And this figure showed the average cigarette price scores by WHO region between 2014 and 2022. From 2014 and 2022, the scores in all WHO regions have risen, but it declined in 2022, except Eastern Mediterranean region. Average cigarette prices were highest in Southeast Asia, Western Pacific, and European region, and the lowest in Africa region. Next slide, please. When we look at the average cigarette price score by World Bank Income Group, the average cigarette price scores rise with the country income. The similar pattern of score drops in 2022 in all income group is observed except for the lower income groups. Next slide, please. Let's continue to the affordability change component. Next slide. Affordability change is another key variable influencing cigarette consumption. It addresses both the price and income because both of them are important factors for smoking behavior. When price decreases and income increases, consumption goes up. The affordability change component reflects the individual ability to purchase cigarettes, and it also considers the cigarette taxes are increased enough to raise the prices by more than the income increases. Inflation and increase in purchasing power because of the economic growth undermine the impact of tax and price increases on the cigarette consumption. This has been evident in many lower middle income countries in the recent decade. Next slide, please. This is the rubric for the change in affordability scoring, and the highest score is 5 and the lowest is 0. Affordability in this case is defined as the percentage of per capita gross domestic product required to purchase 2,000 cigarettes of the most sold brand of that particular country. For the rubric, we look at the percentage of average annual change of affordability for the past 6 years period from 2016 to 2022. Countries get the highest score of 5 when they have 7.5% average annual change or higher, and the change is statistically significant. The score reduced by 1.4 decrease of every 2.5% in average annual change in affordability. The 0 score meant that the affordability for the cigarettes in that country did actually increase, or there was no statistically significant change in the 6-year period. Next slide, please. This figure explains the overview of the affordability change score in 2022. We have a very different picture from the previous price component. Many countries in the map have lighter blue color, which means that they have a really lower score. Only 9 countries out of 188 countries with the available data can make the highest score of 5. On the other end of the spectrum, 156 countries score 0. This is up from the 116 countries in 2020. Next slide, please. This figure shows the changes in countries' affordability score between 2014 and 2022. The score decreased to 0.55 in 2022, although it was 1.13 in 2014. Only 15 countries saw more than 2-point increase, while 41 countries experienced 2-point or greater decline. Next slide, please. Okay, so this slide shows the average affordability change score by WHO region between 2014 and 2022. So you can see in 2022, all 6 regions experienced significant decline in the average scores. The highest average score is seen in the Western Pacific region, followed by African region. Next slide, please. So this figures represents the average affordability change score by World Bank Income Group between 2014 and 2022. For the first time, the highest score for 2022 is observed in lower income countries. The high income countries in 2022 had the worst average change in affordability, which is a large drop from 2020. The 2022 data highlights that we have a lot to do to reduce cigarettes affordability in the majority of the country. So I would like to invite Hye Myung for the rest of the component.
Thank you, Samin. Hello, everyone. My name is Hye Myung, and I am currently a postdoctoral research scientist at Columbia University. I worked with the Tobacconomics team when I was a doctoral student, and I continue the work on with my colleagues on the Cigarette Tax Scorecard. I'm very happy to be here and be part of the presentation today. And now I will move on to the third score component, which is the tax share. So for the tax share component, there were 2 common benchmarks used that are widely used for tobacco taxation. The first benchmark is based on WHO recommendation that the sum of all taxes should be greater than 75% of the average retail price of a tobacco product. The second benchmark is based on the 2010 WHO Technical Manual on Tobacco Tax Administration, stating that excise taxes should be at least 70% of tobacco product retail price. Next slide, please. Then why is tax share important? The share of tax in retail price is a critical tax performance measure. This is because higher tax shares generally result in higher retail prices and eventually result in reduced tobacco consumption and also greater government gains in revenue. So when taxes are increased to a sufficient level that is recommended, the prices typically increase significantly, which motivate many users to quit and deter a lot of youth from initiating tobacco use. Next slide, please. Here's the rubric for the tax share component, where we use the averages of 2 tax share scores, which are based on the WHO recommendations. The total tax share gives the highest score to countries that have a total tax share of 75% or higher. And the excise tax share gives the highest scores to countries that have excise tax share of 70% or higher. And both tax share scores give lower scores that have lower tax share. Next slide, please. Here is the overlay of the most recent tax share component score. We observed that there were only 4 countries receiving the highest score of 5 for this component, which were Andorra, Estonia, Finland, and Madagascar. However, as you see here, there are still a lot of light blue countries, which are 41 by count, that scored score of 0, representing that they scored 0 for both the total tax share score and also the excise tax share score. Next slide, please. So when we look at the tax share component over time, there was a modest increase where the average score increased from 1.9 to 2.2 between 2014 to 2022 at the global level. However, the orange colored countries still represent no changes over time, that were 73 countries by count. Still, there were 69 countries that had increases in their scores, while there were 38 countries which had experienced decreases in scores. Next slide, please. So when we look at the tax share score by WHO region, here this graph shows a notable bars for the European region countries. However, on the very left side of the graph, you see that the African region countries had the lowest scores over time. It is also, we would like to note that there was the highest gains for the Eastern Mediterranean countries over this period, as you see the steep increases in the bars here. Next slide, please. When we look at the tax share component by World Bank income group, similar to the cigarette price scores, we observe that the tax share scores also increase with country income. And as you see the drastic differences between the lower and high income countries, the higher income group showed that the scores were nearly 3 times higher compared to the low income countries. Next slide, please. So now I will move on to the fourth component, which is the tax structure. Next slide, please. So typically, tobacco products are subject to excise taxes, which could be either in the form of specific or ad valorem. Specific taxes are taxes that are applied as per unit of the product. So it would be a certain amount of tax per stick or per pack. Ad valorem excise taxes are taxes that are applied as a form of percentage. Which could be applied to the manufacturer price or the retailer price. And hybrid prices are a combination of both the ad valorem and specific taxes. There are some jurisdictions that set different tax levels depending on a certain feature of the product, which could be either the length of the product or the pack's price category. And these tax structures are called tiered tax systems. Next slide, please. Then why is tax structure important? Tax structures significantly affect cigarette price and plays a critical role in determining the effectiveness of taxation to reach government goals for public health purposes and revenue purposes. The mechanism behind is price variability. So tax structure affects price variability, and when greater variability in prices creates much more opportunities for smokers to trade down or switch down to cheaper brands when there are increases in taxes or prices. And apparently this is pretty much opposed to the government purpose to make these smokers quit or cut back on consumption. And also specific excise taxes are reported to be much more effective in raising consumer prices as compared to the ad valorem taxes, and resulting eventually to greater reductions in cigarette consumption. Next slide, please. Then how does tax structure affect consumption? Research report that specific excise taxes result in greater reductions in cigarette consumption, while complicated tax structures such as tiered structures or systems that have a greater share of ad valorem taxes are associated with higher cigarette consumption as compared to uniform specific tax structures, which are much simpler. Next slide, please. So here's the rubric for the tax structure component. We give the highest scores to countries that have either a uniform specific tax with a automatic inflation or other adjustment, or a uniform mixed system with greater share of specific tax with the automatic adjustment for specific component and retail price set as the base for the ad valorem component and a minimum specific tax. And lower scores are given to countries that put higher emphasis on ad valorem systems or complicated tax systems such as the tiered structure. Next slide, please. Here's an overview for the tax structure component scores for the most recent version of the scorecard. Here you see a lot of dark colors, which represent the highest score of 5. And we observed that there were 21 countries that received the highest scores for 2022. Next slide, please. When we look at the changes over time between 2014 to 2022, we see an overall improvement that the average score increased from 2.5 to 2.9 between 2014 to 2022 at global level. However, still, we see a lot of orange countries here, which represent countries that did not have any changes in their tax structures. Still, during this period, 44 countries had made improvements in their scores, while 13 experienced decreases in their tax structure scores. Next slide, please. So when we look at the tax structure score by WHO region from 2014 to 2022, we see that the African region countries experienced the largest gains during this period. However, we would note that there were slight decreases in the Southeast Asian countries during this period, which is a little alarming because the average score of these region countries were already pretty much low compared to the other region countries. Next slide, please. When we look at the tax structure score by World Bank income group, similar to the price and tax share component, we observed that the tax structure scores also increase with country income. While all income groups experienced increases in their tax structure score between 2014 to 2022, we would like to note that the lower income countries showed the largest average score increases compared to other income groups. Next slide, please. So now I will hand over this presentation to Jeff, who will discuss the conclusions of this report.
Thank you so much, Hye Myung, and thank you, Min. These were really thorough explanations of the 4 components. I'm grateful for those. Before I proceed to conclusions, I would like to make, I guess, a couple of announcements that I probably should have done at the very beginning. Please note at the bottom of your Zoom screen, there is a Q&A box. Please feel free to ask us questions about the scorecard or anything to do with tobacco taxation. We would be delighted to have some questions from audience members so that we can have a short discussion after Rosa Sandoval's discussant presentation. Please also note that you can go directly to our website, tobacconomics.org, and you can download the entire full report. And in the full report, they have full annexes and appendices for all of the scores for your countries. So you can go and see each of your country's component scores and overall scores, and you can see all of the other information that's not included in this presentation. So that is available already on the website. As well, we will be posting this PowerPoint eventually on the website too. And then also we will be, over the coming months, developing regional reports from the scorecard so that you'll be able to contrast and compare countries within regions and even some country level reports. So stay tuned on our tobacconomics.org website because we have a lot more material coming out of this. And in fact, we'll also have some other, we're going to dig deeper, especially into the affordability findings because we found them particularly interesting and complex. So stay tuned. We have much more coming. So please visit our website. So now on to conclusions here. Next slide, please. What have we learned over the last 25 minutes? Well, I think if we look at the first column there, we have learned that price is too low and unfortunately in a lot of places, remarkably so, getting lower. This is really worrisome to us, as I said before, and Min also reinforced, consumers react to prices. So when you have low prices, this is quite problematic for both public health and fiscal health. This is not going to be good, and this is not going to achieve our goals of making tobacco products less affordable. In the second column there, change in affordability, this was our lowest performer. As you saw in the map that Salman put up, that was a whole lot of light blue and not very much dark blue. And that is probably the thing that worries us this most. So in only 1/4 of countries are tobacco products becoming less affordable, our goal. And you might think, and I know a number of you are probably thinking this right now, well, the pandemic was a confounder, and we do believe that that's true. And there are two dimensions to this. When we did the second edition of the scorecard, we actually think that it's possible that the performance on change in affordability was actually overestimated. And that was because, in fact, a lot of countries were struggling economically. And so actually things became less affordable because of what was happening on the macroeconomic environment. And this time, because we had rapid growth in quite a number of countries and inflation struggles, it was what we're probably doing is overestimating the effects here. So what we overestimating the negative effects that we're seeing. However, I want to wrap that in a strong amount of caution, because we actually were able to separate out the effects quite a lot. And as I said, there will be a subsequent publication on this, and we will share that eventually, because we've really looked at this much more closely. But I can tell you that there's a whole other dimension. This dimension has to do with policy inaction, I would say, or not doing what we would recommend doing. And what we know is 156 of the countries scored 0, meaning either things were becoming more affordable or there was no change in affordability. So of those, we saw that there were 25 countries that had no increase whatsoever in 6 years, and cigarettes became more affordable. We saw an additional 56 countries with absolutely no tax increase in the 6 previous years. And in those cases, cigarettes affordability didn't change very much, at least not in a statistically significant way. We saw an additional 16 countries where there were small increases in taxes, and they became more affordable because obviously those changes were outpaced by inflation and or economic growth. And then we also saw 59 additional countries where the increases were small and there was no change in affordability that we could identify statistically. So you can see this is much more than about the macroeconomic situation. This really has to do with governments not doing enough to raise their excise taxes. We have a lot more work to do here. Now, over to the third column on tax share, we know that, in fact, this is going up incrementally, and we're excited about that, but we would have to say that it's going up too slowly. We know that countries that do well on this score typically are high performers, but what we see is not that many countries are hitting these international minimum benchmarks. And we would like to see countries really starting to strive to hit those benchmarks, because we think that will be a point at which we see a real turning point in performance. And then the last column there is tax structure. And though we did see some modest improvement over time, and we were excited to see that, we did see 13 countries go backwards and actually introduce less optimal structures. But we still have a lot of countries really not doing the things that they're being counseled to do in terms of improving their tax structure. And that includes relying far too much on ad valorem taxes, which can be easily manipulated by the tobacco companies. And perhaps worse than that, what we see is a lot of countries still relying on these tiered tax structures. And as we discussed, Hye Myung mentioned that when you have these tiered structures, they are not optimal because it creates a lot of opportunities for tobacco users to trade down to a less expensive product. So you might raise taxes, but there are still lots of relatively inexpensive options open to users, and this is not what we want to see. So we'd like to see great improvements on tax structure in the coming years, especially in those tiered countries. Next slide. So what should policymakers do? Well, that's pretty straightforward here. They need to implement regular tax increases that outpace inflation and income growth. We need to increase the price of cigarettes, and we need to make them less affordable for smokers and other tobacco users. We need to simplify these complex tax structures that I just mentioned, and that helps with being able to administer taxes better, and it decreases the risk for both tax avoidance and tax evasion. And then we must ensure that all brands are covered equally. This is something that we're seeing in a lot of places where there are still cheap brands. What we would like to see is no cheap brands anywhere. Why do we do this? Well, we know that it is when we raise prices, we protect especially vulnerable populations, including youth and those in lower socioeconomic groups. These folks are much more sensitive to price. So we know that this intervention works especially well. I should also mention that it is a progressive policy, that we see the rewards of these tax increases go disproportionately to those folks in those groups, which means that, in fact, they're better off in the end. So taxation is a progressive policy. We know that raising taxes is going to prevent the expansion of cigarette markets. We've seen, and if you go to our sister site, the tobaccoatlas.org, you can actually see some really good visual demonstrations of how the tobacco industry is growing its markets in a lot of lower income areas, especially in Africa and the Eastern Mediterranean regions. So we're very worried about the expansion of these cigarette markets because they're targeting young people especially. We know that doing this will improve population health. It's going to decrease tobacco attributable disease and death and all of the costs that come with it. And then, as was mentioned before, this is an inelastic good or a set of goods. And so when we increase the tax, we know that not only does consumption go down, but government revenues go up. And those revenues can be reallocated towards good things like human development, such as improving education policy and healthcare. I am going to stop there, and I am going to hand this over to my colleague, Rosa Sandoval from Pan American Health Organization, and she is going to act as our discussant. Over to you, Rosa. Thank you.
Thank you, Jeff, and good morning, everyone from Washington, D.C., and thank you to my colleagues and friends from Tobacconomics for inviting me to join your event today. First of all, congratulations for presenting these results. I do believe this is a very powerful tool, the scorecard, for us to see where we are in terms of tobacco taxes. And now we don't only see the photo, but we also can see a movie, right? We have data from 2014 and see how we are evolving in the four criteria that you use to assess tobacco taxes. Well, unfortunately, disappointing news this year. Let me start by that, right? For many of us who work on this topic, this is certainly not what we would like to see, as Jeff said, right? They are worrying news, in particular, of course, about affordability. So out of the four criteria, right, we see we're doing much worse in affordability. We're doing worse in terms of price. We're doing a little bit better in terms of tax share and tax structure, but quoting Jeff, too little, too slow. So we certainly need to do more. I was particularly, let's say, very disappointed when I saw that only 9 countries received the highest score in affordability compared to 26 in 2020. But thank you, Jeff, for providing us of that really very educative and informative macroeconomic context. I certainly agree with you that this goes beyond that, and that we need to look at what governments can do. And certainly, there are much more. There's lots of room for governments to do more. Efforts are really very far from where they should be. In particularly, the around tax share and tax structure, the differences between high income level countries and lower and middle income level countries are still too big. But having said that, I do wanna make a few reflections on what we can do next based on these results, and how, if you allow me to say it, how we can still, despite the results, be hopeful with our feet on the ground. And let me start with 2 stories from the Americas. One is that certainly in the context of the pandemic and post-pandemic, the context did not only mean impact us on the macroeconomic level, but in particular, in the case of tobacco control, what we saw was redoubled efforts on the part of the industry, not only not to let us progress in terms of making a better use of tobacco taxes as an instrument to reduce affordability, but they demanded us to protect our gains because there were efforts against the goal of using taxes to reduce affordability. And we had two examples in the region. One in Suriname, where there was a proposal to actually move a tax structure from a uniform system to a tiered system. So the other way that we would like to see, or where we see other countries where tax were reduced, like in the tax rates were reduced, like in Ecuador. But in both cases, we were able, or the tobacco control advocates and the community, jointly with the government, were able to stop these efforts based on what allows us to continue forward, which is that in the world, we do have overwhelming evidence to support the use of tobacco taxes. And there is, I think there is hope and there is an opportunity for us to use that evidence to counter this effort from the industry. And I'm wondering if that evidence were not there and if that capacity were there, what would be the results? Because we have seen during these years how it was not only about moving forward, which, as we can see in the results that you're presenting to us today, they are showing us that we are not doing enough in general, as the world, as a society. But there were also efforts to move us backwards. And I'm wondering how many of those stories, like the story of Ecuador, where the civil society started constitutional litigation, in order to change that decree that was reducing tobacco tax rates and other tax rates as well, and they were successful about it. Or in how many occasions, it was possible to counter industry's efforts to change tax structure to the worse. I'm sure there are more stories there. So while we definitely need to be worried and need to redouble our efforts to do more, I think we also have the ground to protect our gains, and we have the capacity to move forward. So that was one thing that I wanted to share with you. Then a couple of three other things. I think these results also, when we see that there's some progress in tax structure, some progress in tax share, but it's not enough. There are opportunities that we've seen around the world, and one of them is that tobacco taxes and health taxes in general are increasingly being part of the broader framework of the discussion on tax systems. This is something that since I've been working on this topic for 20 years, I can say that in 20 years ago or 15 years ago, we did not see tobacco taxes or health taxes being part of the discussion of the policy debate on tax system and how tax systems can contribute to the development. So there, I think we have another opportunity that can help us, that maybe in 2 years, when you present the 4th edition of the scorecard, we can see that we were able to revert the trend or the recent trend that you've shown us today. Another source of opportunity or of hope, if I may use that word, is that we see more and more interest on the part of ministries of finance to look at excise taxes as an instrument to contribute to sustainable development or to health outcomes. And we see that when we are discussing, when they are discussing tax reforms, as in Colombia or in Brazil, or when they are approaching colleagues as you in Tobacconomics or as the World Bank or WHO, they are paying more attention to the contribution that excise taxes the role that they have on this. In the case of Colombia, I don't know how many of those joining us are aware too, but in the context of the tax reform, there was one chapter on health taxes. Tobacco taxes did not make it there, but still, I think it's an opportunity when in a big policy debate, excise taxes, health taxes have a room, even if in this particular case, tobacco tax was not specifically included. But we're seeing that conversation in Brazil. In the context of the tax reform in Brazil, we see how taxes on that are harmful to health and the environment are included. So I think these are good news, despite the disappointing results that we've seen today that we need to see, we need to hear also when we're not doing well, but there are opportunity to move forward. And one thing that the final comment that I have is that in all of these efforts where we've been able to either protect gains from tax to go the other way that we would like to see tobacco taxes going, when something that has been very important, very helpful is the voice of the health authorities and the health community in general. And I think this is a call for us working on tobacco taxes, or for us as economists, that this is a fight that we don't fight by ourselves. We do this in collaboration, and an example of that was I just mentioned in Ecuador. It was the civil society who presented this litigation in order to protect the tax rates. So I think it's important for us to remember that this is the work that we do together, where health authorities have been crucial in doing the advocacy, in presenting the case for tobacco taxes as a health intervention as well, not only a matter of fiscal revenues. And again, thank you very much for inviting me today. Over to you, Jeff.
Thank you so much, Rosa. Those were fantastic remarks, really spot on. I think I speak for the whole Tobacconomics team that we wholeheartedly agree with everything that you have just said. So thank you for adding this rich context and these very thoughtful reflections on really the state of tobacco taxation in the world and how we should be and could be doing better. So thank you. I think we have about 10 minutes left here, and I'm going to hand this over to my colleagues, Germán Rodriguez Iglesias and Carlos Guerrero, who are going to moderate our question and answer session. So over to you, Germán and Carlos. Thank you.
Thanks, Jeff, and thanks everyone for the really good questions we received on the chat. So one of the questions we received was related with the scoring methodology and how this may impact on the case of economic collapse in countries going through a war. This is exactly why this scorecard is compiling data from the WHO. We are going to get data for what's happening in the country, and we're going to evaluate that countries that have economic collapse and cigarettes are getting cheaper, or there is no update on the tax because of the collapse of the economy or because of the war, there will be even a more vulnerable situation. The cigarettes will be cheaper. And it is the opposite. In case a country use increasing taxes to collect more revenues related with, for example, the collapse of the economy or a war, we will see an increase. So this is not directly linked with the economic collapse. This is not measuring that. This is measuring how the evolution of the tax structure and the price on cigarettes. Carlos, do you want to go with other question?
Sure. Thank you very much, and thank you all for your very interesting questions. I have a question from Joel Donington. The question is, how do you decide the national excise tax level when individual states also have their own excise taxes? Do you average the state taxes into the federal tax? So I think that's a very good question.
It is a very good question. I'll take that one, Carlos. So when we do these calculations, we don't actually, that is not the way that the World Health Organization is calculating. They're looking at national level excise taxes. There's so much variation in countries that do subnational taxation that it would be very difficult to do this methodologically. The United States probably being the one with the most variation. So I guess I can speak more abstractly about this. You know, we're trying to drive up the price of cigarettes and other tobacco products through taxation. And obviously, a far more efficient tool is to use a national level excise tax. Obviously, failing that, when the national excise taxes aren't being raised, like in the United States, then we're, obviously our second best solution here is to see individual states raising their state excise tax, or even in the United States, we see local excise taxes, which is quite remarkable and quite complex. But ultimately, what we would really like to see is these high national level excise taxes. So in a way, I suppose in the United States, they're being penalized with a low score because of their very low national tax, when in fact there are some jurisdictions like California or New York City with very high taxes that would perform better on their own, but don't. So we really would like to see these, as I said, these national level taxes. And this just, we don't, unfortunately, there's a certain point where the complexity and the level of sophistication, I think, starts to work against you. And with this scorecard, we do have to keep it to a certain level of simplicity in order to be able to compare across countries. So we've avoided these subnational taxes, which are actually pretty unusual. They're not in that many countries. Thank you.
We have other questions, like, for example, some of them related with data. For example, this question from Hasha, is the source of data information from similar authorities agencies from all countries? How do you validate the data and information? I don't know if Hye Myung, Min, do you want to respond that? I can respond if you don't. Okay, so yes, as in the presentation, Chef and the other participants present, the data, most of the data is from WHO, that is linking the price variation, tax structure. And also when we need to use some measure to compare all the prices across the countries, we use World Bank or other global agencies to have the international dollar. So yes, we have information that is publicly available from authorities and agencies that are all the time being controlled and being reviewed, and we validate the data. Yes, indeed, we control for the data from previous WHO, and we adjust if needed if there is any small variation or correction on previous years on the WHO reports. But again, all the information is publicly available, and all the information from the source we use and also on the scorecard will be uploaded on the Tobacconomics website.
Herman, can I also add, I saw a question in the chat box asking us about other tobacco products. And we call this the Cigarette Tax Scorecard because we only evaluate cigarette taxes here. And we would love to evaluate taxes on novel tobacco products and smokeless tobacco. But the fact is the data aren't there. We just don't have good enough data at this point to be able to evaluate these other products in a sophisticated way across a lot of countries. I think eventually, hopefully when those data start to be generated, we'll be able to expand the scorecard to evaluate some of these other products. But at this time, we can't do so in a way that we feel is reliable and that we could stand behind as a group and say that we trust what we're presenting. So that's why we're stuck with the Cigarette Tax Scorecard, and we acknowledge that it is a weakness of not being able to explore these other products. But I can assure you that we're watching this carefully, and when things change, we will tackle those as well. Thank you.
So there's another question that is related to what you have just said, Jeff, but it's a more conceptual question. And the question is from Fahim Ahmed, and he says, if the taxes in few countries are only applied to cigarettes and not to other tobacco products, would not it be increasing the use of other tobacco products and e-cigarettes, heated tobacco products?
That very well could be happening. in places where there's very low taxation on these alternative products and their prices are lower in comparison. You know, if you try to compare unit by unit, it's more complex than that because we don't necessarily see that it's always a perfect substitute. People who smoke cigarettes don't always want to switch to a novel product or like a electronic cigarette or a oral nicotine product. But some people do, and if they see that they're much cheaper, then they might do so. And if you have looked at the World Health Organization's latest tax manual, there's a very good section on taxing novel products. And I will very, very crudely paraphrase it, but it basically says try to do so at an equivalent level so that there's not a big difference in the prices between the cigarettes and the other tobacco products. So that really is the goal. It's tricky because of the huge variety of different types of products, and taxing them isn't always very, very straightforward. But again, I highly recommend the manual because it gives you some excellent clues as to how to try to achieve that goal.
Thank you very much, Jeff. We have a question also from Abdullah Hassan. In a complicated but slowly improved tobacco tax system, what can we learn from other countries' process? What country is ideal in terms of simplifying the system? And there's a related question. If we increase regulated price and the tariff, then the excise rate is not that high, although the price increase quite high. What do you suggest?
We have a lot going on here. I'll take the first crack at this. So first, I want to tackle, and there was another question here about large increases versus small increases, and I want to actually touch on that for a moment as well. So when we have these complex systems, it just creates a lot of opportunities for there to be price variation. In other words, cheaper things and more expensive things, and we always run the risk of there being the opportunity for smokers and other tobacco users to trade down to a cheaper product. So we really look closely at the tax structure and make sure that it is uniform as possible so that we're treating all types of goods and brands the same way so that we can raise the price of all products up and that will affect consumption. So, you know, when we see these tiered structures, we know they don't work. Categorically, they do not work. And so we really encourage uniform taxes as much as possible and then trying to reach this benchmark of equivalency, but also raising all prices. You know, you might have super luxury brands that are very, very expensive, but we want to make sure that the less expensive brands are still really quite expensive and not accessible. In terms of small tax increases versus large tax increases, this is a tough one, and one that we've been struggling with as a community, because we ask for these very large increases because we know empirically that they work, that there's a big reaction in terms of people's consumption behavior. But we also know that the countries that have had successive year after year, smaller incremental increases, they do build up over time. And they're very good, and they may be more politically feasible. So I don't want to discourage countries from doing that. If they realize they can't get a big tax increase, you know what? It's okay to try to instead put the country on a tax calendar or schedule so that there are these successive increases over time that may be smaller each year. But when you look at it, you know, a country like New Zealand that had, I think, successive 10% increases above inflation for a series of years. If you look at the starting point and then the end point after those successive increases, it was a large difference in tax and price, and it had a very large effect on consumption in the direction we wanted and across all groups. So I think the answer is we'll take it, and it's very hard, and we're working very hard to get tax increases everywhere. I see that we are at time. Do we have any last words from our panelists here? Well, I would like to thank our panelists and Rosa Sandoval for her excellent discussing comments. And I'd like to thank all the authors of the Atlas, several of whom could not be here today. And I would like to thank all of you for coming today. And please visit our website at tobacconomics.org, and you can download all of this and much, much more. And we look forward to seeing you next time. Thank you again.